plastic surgeon gave kids fake COVID jabs and sold fake vaccination cards for $97,000.
Desperate man, who couldn't get NHS, dentist pulls out 5 of his teeth with pliers.
One type of physical activity protects the brain more than others, study finds.
Hero dad loses both legs diving in front of snowplough to save his 2 young daughters.
Stricter rules for tattoos and piercings in Wales.
Common nail salon tool may cause DNA damage and mutations in human cells, research finds.
Woman forced to wear mask after dentist disfigures her face in botched illegal nose job.
India launches its first inhaled COVID vaccine.
Plastic surgeon gave kids fake COVID jabs and sold fake vaccination cards for $97,000. A plastic surgeon allegedly gave kids fake COVID shots and made $97,000 selling fake vaccination cards. According to allegations, anti-vax parents paid Dr. Michael Kirkmore Jr. from Utah to administer fake COVID-19 vaccinations to their kids. The Utah's U.S. State Attorney's Office stated that he allegedly gave children saline shots rather than the COVID-19 vaccine, and would give them a fake vaccination card that claimed the kids had received the COVID vaccine. In addition, Dr. Moore allegedly dumped thousands of dollars worth of COVID jabs down the drain to destroy them. The doctor allegedly carried out the scheme with the help of 2 of his employees and a neighbor. They allegedly created fake COVID immunization cards and offered them for sale for $50 per person. The 4 accused allegedly ran the fake COVID scheme in Dr. Moore's Plastic Surgery Institute of Utah Incorporated office. The Centers for Disease Control and Prevention gave him permission to administer vaccinations.
Desperate man, who couldn't get NHS, dentist pulls out 5 of his teeth with pliers. During the course of a 2-year period, a man has spoken about the excruciating pain he claims he felt while extracting 5 of his own teeth. In Wakefield, Ferdy, 51, claims there are no NHS dentists within a 25-mile radius. Unable to stand the pain any longer, he took matters into his own hands. After trying to get private dental care to fix his mouth after receiving his PhD in political philosophy, photographer Ferdy was shocked to learn that the cost would be £16,000, far more than he could afford. At the start of the pandemic, when he discovered he couldn't even see an emergency dentist, he made his first foray into do-it-yourself dentistry. Ferdy decided to painfully remove the tooth himself using a pair of common household pliers, because he felt like he was teetering on the edge of insanity due to sleep deprivation. Speaking to the mirror, Ferdy said, "I grabbed hold of it and started to pull. Oh my God, the pain. The pain was just excruciating. It just went all across the side of my face, is absolute agony. I thought, just keep pulling. Keep pulling." So I kept pulling and it was just agony. But then I could hear the bones cracking, and then it just came out. However, Ferdy ultimately had to extract 4 more teeth from himself. The earlier ones were at the back and the more recent ones were at the front, leaving him with a sizable gap that he likens to that of a 10-year-old.
One type of physical activity protects the brain more than others, study finds. Running up and down stairs, biking or brisk walking are examples of moderate physical activity. Your heart rate and breathing will increase if you engage in vigorous movement, such as aerobic dancing, jogging, running, swimming, or biking up a hill. The results of the study, which were published on Monday, 23rd of January, 2023, in the Journal of Epidemiology and Community Health, showed that doing just under 10 minutes of moderate to vigorous exercise every day improved study participants' working memory, but had the biggest effect on executive functions like organization and planning. According to study author John Mitchell, there was only a small cognitive improvement at first, but as more time was spent engaging in the more intense exercise, the advantages increased.
Hero dad loses both legs diving in front of snowplough to save his 2 young daughters. A brave father, who jumped in front of a moving snowplough to save his 2 daughters, lost both of his legs. Quick-thinking Dave Milne noticed the vehicle heading directly toward Isla, age 3, and Anna, age 1, after taking lessons at a ski resort in California. He threw himself in front of the girls without thinking and was then pulled into the machinery. Dave, a former member of the Australian Defence Force, lost his right leg above the ankle and his left leg above the knee. Isla broke both legs, but is expected to recover fully, and Anna escaped unharmed. The family has moved back to Australia from San Diego, California, where Dave, his wife Claire, and their daughters were previously residing.
Stricter rules for tattoos and piercings in Wales. Wales is about to become the first country in the UK to require licenses for cosmetic clinics, body pissers, and tattoo artists. Through the creation of a public register of license holders, the stricter controls hope to lower infections and poor working conditions. 1,868 business locations will need approval, and approximately 3,500 practitioners will need licenses. The Welsh Government has begun a 12-week consultation. The new regulations mark the culmination of changes made in accordance with the Public Health, Wales, Act 2017 to raise industry standards for infection prevention and control.
Common nail salon tool may cause DNA damage and mutations in human cells, research finds. According to a recent study, radiation from nail dryers may damage DNA and result in cancer-causing mutations in human cells. This finding may make you wonder if getting your regular gel manicure and pedicure is worth the risk. The findings of a study published on January 17 in the journal Nature Communications, according to some dermatologists, are nothing new when it comes to worries about ultraviolet light coming from any source. In fact, the outcomes confirm the rationale behind why some dermatologists have changed or discontinued their gel manicure routines.
Woman forced to wear mask after dentist disfigures her face in botched illegal nose job. A woman feels uncomfortable when people stare at her, after a dentist disfigured her face with a botched and illegal nose job, and she claims that she always wears a mask when she leaves the house. After seeing an online advertisement, Ilielma Carvalho Braga, 37, decided she wanted to make her nostrils smaller. In June 2020, she went to a dentist appointment in Aparecida de Goiânia, Brazil, but was injured horribly on her face when the skin around her nose started to blister and rot. She had necrosis, which is defined as the irreversible death of body tissue, according to medical professionals. It happens when the tissue receives insufficient blood flow. Igor Leonardo Soares Nascimento, a dentist, is accused of causing great bodily harm and carrying out an unlawful procedure. According to the dentist, Ilielma's pre-existing medical conditions, not the operation, were to blame for the necrosis. The victim claims that even after 13 corrective surgeries, the effects of the failed procedure are still bothering her. She was left with a scar that covers most of her face and requires dilators in her nostrils to breathe. She is currently suing the dentist for £6,600 in damages in order to make up for her suffering.
India launches its first inhaled COVID vaccine. The first nasal COVID vaccine has received approval in India. INCOVACC, a product of Bharat Biotech, is a nasal drop that triggers an immune response in the tissues lining the nasal cavity. A spray-based COVID vaccine for inhalation was authorized in China in September 2022. Scientists say that nasal vaccines may offer added immunity in the lining of the nose and upper airways, where COVID typically enters the body. Nasal spray vaccines have also been the subject of investigation by research teams in the US and the UK. India's drug regulator approved in November the use of INCOVACC as a heterologous booster dose for individuals who had previously received 2 doses of Covishield or Covaxin, the 2 main Indian vaccines in emergency situations among adults. The drug regulator approved it in December for use in adults as a primary vaccine and as a follow-up booster shot. For your daily global health news, visit www.StayWellWorld.org. Please do well to subscribe, like, share and comment. If you've already subscribed, turn on the notification icon so you don't miss any update. Thank you for watching.